There we go. So, the first thing I'm going to do is I'm delighted to introduce Nick and his cat. Nick is someone who's led the development of these partnerships, which was inspired by the university's UK framework launched last year. And I know we've got some non-higher education colleagues in the room. So, for anyone who doesn't know, Universities UK is the membership body for kind of vice chancellors across higher education. And last year, a report was released into kind of how to address student drug use. Nick identified really the opportunity to take the principles from that report further in developing a whole city approach. So it's actually Nick's vision that's given shape to kind of today and led us to this webinar. So I'm going to pass over to Nick to give a sort of intro to the work.
I do like to be so professional. Sorry, just being attacked by a cat. I'm actually on holiday in Scotland at the minute, and we have a cat who is a Scottish wild cat mainly. And so trying to persuade him gently not to press the keyboard and exit me from the meeting has been what I've been trying to do. Anyway, apologies for that, friends. And Tracy, thank you for that lovely introduction. In fact, of course, this is a really important collaborative venture. And I know there's fantastic expertise around this table, so I'll do my best not to try and overemphasize the basics, but there's one or two things I'd just like to highlight really from that earlier work that UUK led. And first of all, that was starting with a focus on drugs rather than drugs and alcohol, but we're really aware, of course, that these two things have a significant interplay, and that's part of Tracy's work and SOS work going forward. And secondly, that work was undertaken because although Carol Black had undertaken a lot of research across the UK as a whole, and particularly in age groups that are very typical of undergraduates, in fact, there hadn't been any systematic research directly of students until that time. And I think, to be very honest, that was partly because people were worried about the negative or the potential negative publicity from focusing in that area. The counter argument, which I'm sure will be familiar to everybody here, is well, while we rely on anecdote, then actually we may be missing some really important actions that we should be taking on drugs and potentially also on alcohol that impact in a whole range of areas. And that turned out to be the case. So the research is very carefully designed to look at both drug taking and non-drug taking on the impact on students that have taken drugs and on the impact on students that have not taken drugs, and to take that very holistic approach. And we probably found slightly less reported drug taking than we might have expected from, for example, the Irish survey that had been completed a year before and from some other international measures. But nonetheless, it was quite clear that there was impact on health and welfare from drug taking, impact on young people's and more mature people's study, and impact on others, not least because people were then becoming more exposed to criminal activity of one sort or another. But the crucial thing was that, of course, this wasn't a simple problem, and there's definitely not a simple solution. So it's not that people were always starting to take drugs at university. In fact, the majority had started experimenting with drugs prior to coming to university. And then, of course, there was all the sort of issues about how and where people are gaining access to drugs, where and when they're using them, and with what effect. And so what we were really finding was that the more traditional approaches, sometimes a zero tolerance approach, sometimes other approaches, that tried to perhaps see it as a singular issue located mainly in the individual student, were not the ones that most reflected the research in the area and not the ones that reflected advanced practice in the area. And what we wanted to do was see what we could do to stimulate both a research-led and an expert practice-led approach, which essentially was looking at modes of collaboration so that we understand students as part of society, as part of students groups, as part of other groups, and we understand them as being connected in, of course, to universities, but into nighttime economy, into to accommodation, into the health service, and sometimes into the criminal justice system. And that just trying to change things by changing any one of these spots in an interconnected system is not likely to work. And so, as Tracy was saying, we really through the work of SOS and others, um, put the big focus on collaboration, but with collaboration which puts students at its heart, assuming that there is a complex, interactive, and dynamic process going on here. It's not just about individuals and it's not just about a deficit model. And we have to assume that the potential for change combines all of those things. Of course, it's personal change, but it's system-wide change as well. And so, what we're proposing in this pilot phase of the next piece of work is something I know will be familiar to many because you're already doing this in many ways, is to think about how we work in a collaborative way, including many of those organizations I've talked about, and that we have a research strand that sits alongside it so that we're also gathering evidence of how good practice in one area might or might not spread to another, how we have learning at the heart of it, and how we connect between those different areas in terms of the evidence overall of what works. Um, and so, just to give one example of that, we know that students tend to be much better at listening to each other than listening to academics in settings like this. So, the work that's been done on communication studies and student-led communication studies, but the communications that are then worked through both social media and technology and through accommodation providers and the nighttime economy. These sorts of things turn out to be really significant, along with the way people then access services. So that's really by way of background. I think Tracy is going to take you through some of the details of the proposition, and I do hope that I'm so excited really that so many people are here. But I do hope that from today we might build up a real swell of movement that recognises the great work that's already going on, and I know you represent that in many ways. But I'm hoping that we might do a little coordination of that that would help everybody here and help future generations of students and professionals. Tracy, thanks so much.
Thank you, Nick, for that introduction. Um, I was so pleased when Nick reached out actually and asked us to support on this work because it's a really exciting project. And actually, as I was writing this webinar, it did lead me to think, why hasn't this been done on a larger scale before? So I really look forward to kind of supporting it and watching it develop. So the first thing I want to talk through is kind of why we were doing this pilot. Nick's given a bit of information around how it kind of came out from the Universities UK report, but I want to kind of walk us through the reasons behind this. So the first reason really is the need. And I'm going to look at data from that. I'm going to look at data that we gathered in the 23-24 year around kind of painting a picture of what student substance use is like. So I'm just going to run through these fairly quickly. There's lots more data in our reports, but the the data from that year showed about 73% of students say that they consume alcohol, with 31% saying that they intentionally get drunk once a week. We had 37% said that they'd used drugs at some time. And then also what we look at is kind of the impact of that. So I've just picked out a few impacts because there's lots of impacts that we measure. But 38% of students following alcohol had missed a seminar, class, or lecture, 22% following after drugs. We've got 26% of students following alcohol took risks with their personal safety. That was 18% after taking drugs. And 18% after drinking alcohol got into an argument with someone they know. So I think the kind of percentages paint a little bit of a picture. I think what paints more of a picture is when we translate that into numbers. So this is just higher education, and as you'll learn soon, this pilot that we are doing will also include further education. So we're looking at 16 plus. But this is just the higher education data that we have. So in 23-24, there was 2.9 million students in higher education. So if you're one of the colleagues kind of sitting in a city, student population is a vast population of many areas. So when we put these kind of stats into actual amounts, we've got over 2 million students consuming alcohol, with 900,000 of them intentionally getting drunk at least once a week. We've got 1 million students having used drugs at some point. And I won't run through all the impacts, but some of them you've got over 1 million students missing seminars or lectures due to alcohol. You've got kind of 500,000 taking risk with personal safety after drugs, 750,000 after alcohol. They are significant numbers. So I think this is the first step in why we were developing this pilot. I'm going to kind of build up the reasons as we go. So the first one we've got is this need from the data. The second reason that we've kind of developed this pilot is we recognise within areas, within cities, organisations often adopt a wide range of approaches to addressing student substance use. So we have different policies within a city. So if you have a city with multiple universities, multiple FE, they may have a different policy in those settings. We've got different practices, we've got different educational efforts, so information and education. So these differ across regions, but they also differ within a city. We might have a city with multiple organisations doing slightly different things. Um, However, what we know is students in urban areas share experiences. They live in the same neighbourhoods, they socialise in the same nightlife, and they face kind of comparable risks in terms of exposure to the same drug dealers. There might be certain drugs in circulation in that city, and also the same alcohol promotions. This pilot will look at alcohol and drugs. Um, so I suppose the second reason why we were doing this pilot is around that work in isolation. We think there may be duplication. We think there might be missed opportunities. And this pilot's about creating a shared space where kind of education, both higher education and further education, health, local government, police, voluntary sector, come together in kind of a single joined up approach. Now you will already be doing that. This is about kind of, I suppose, lifting the profile of the population. So lifting the profile of the student population in cities. So remembering that's a significant population for many and kind of bringing energy around this shared working. As I said, we're also doing 16 to 18 as well as 18 plus, which I don't believe is happening in many cities at the moment. So now we're building up the reasons. We've got the need from the data. We've got that lots of cities are working in kind of siloed efforts. But there is lots of examples of good practice. And I saw as Nick was speaking, Carly put in around Bristol's approach to a harm reduction city. There is lots of areas where actually universities are starting to work together. Universities may be working with their drugs and alcohol services. They're working with public health. They're working with police. So you might be sitting here and thinking, oh, actually, we've got to need to. And I think as a city, we're doing this well. The third reason for if you sit there, you've recognized the need, but you also feel that you're doing this well, is little evaluation. So across the country, there's lots of examples of good practice where cities are starting to come together. What we find is often missing with that is evaluation. So what difference is it making? Who are we reaching? How do we know it's working? So the pilot, and I'm going to go into the evaluation a little bit later. We've built in evaluation right from the start. So we're not only bringing people together, we're going to be learning about what works and what doesn't work. Is the fact that you're linking up with your public health team really well, that you're working with the police really well, is that leading to actual changes? And I think that's what, for those who are doing really great work in the cities already, we are missing in that area is that evaluation. And evaluation will be in this from the start, and hopefully, and I'll talk about it later, a fully funded evaluation because we are applying for external funding for that. So we've now got the need, the siloed efforts. For those who are doing really great efforts in a city, we've got that evaluation gap. The next reason we were looking at is we have got cities that are starting to work together really well. what we're missing is those cities talking to each other. So if city A is actually like, well, we've got these, we've got the groups, we're starting to work together, we're starting to pull together. We probably haven't identified actually what we're trying to achieve yet. We haven't kind of said, well, we are trying to reduce this number or increase this number or whatever that shared outcome might be. Um, Probably not evaluating, but also City A is not talking to City B, who is also doing it. So at the moment, there isn't really a shared network where, in the student drug and alcohol, is that cities are talking to cities. Um, so that was kind of the next reason of this. It's about not only building that network within a city or an area, it's about building it across cities so that good practice is shared, that we're learning lessons from each city, and we're not kind of duplicating efforts. I've now got you up to four reasons. If I haven't convinced you already, I've got one more reason. The fifth reason we were kind of working, we've developed these pilots alongside Nick, is proven success from other areas. So many of you might know the student mental health partnerships that, from previous that where they were established formal collaborations between higher education and NHS in five cities. This resulted in kind of improved access to mental health support for students. There was stronger cross-sector working, and it kind of demonstrated that structured citywide partnerships can drive real change. There's also the kind of social systems theory, which shows that change is more effective when institutions come together. So we're not starting from scratch here. We know there are proven results from other areas, and we think this approach that the results from that can be applied to student drug and alcohol use. So we know it works in other areas, and so we're confident that it will work in this area. So we've now got five reasons. We've got the need, we've got the fact that institutions are working in isolation, not evaluating it, cities are not talking together, and we've got proven success. And I think when you put them all together, it kind of becomes clear that actually this wasn't just a good idea from Nick and the other task force members at Universities UK. Actually, it's quite necessary that we're doing this. Um, and actually, just when I was writing this webinar and writing all the reasons, I felt really motivated of this is the right thing to do, and that we will get a lot out from it. So I suppose for the first time, we're kind of testing what happens when a whole city or town comes together around one shared goal, and that shared goal to be to reduce harms of student drug and alcohol use, looking at reducing demand, increasing support, a load of outcomes that a city will dictate in what they want to achieve. So yeah, it leads me to question with why hasn't it been done before? So we've kind of looked at why now. So we're going to go on to the kind of what we're doing. Um, so we're not looking to add something on top. So this pilot isn't about kind of adding extra work. It's about bringing together what's already happening in kind of a more joined up and consistent way with an evaluation attached to that. So we're not replacing any existing work. We know that there's lots of great existing work happening in cities, lots of networks. It's about connecting it and making it stronger around the subject of student drug and alcohol use. I was in a meeting this morning where we were talking about kind of public health profiles, and actually admitting that we don't necessarily always know the student population. It's kind of the population in a wider sense in the city. So this is about kind of working together better and getting more than the sum of the parts. So really, this is about the 1 + 1 = 3. We're bringing together and getting a greater reward. So who will be involved will be very much dependent on the city or town. This is a suggestion of some of the key players that we think it will include. So nighttime economy, students' unions, colleges, police, public health, third sector, private student accommodation, students themselves, and university. So each of these people will kind of play a role in designing and delivering the pilot locally. And this will range from kind of strategic leads to frontline practitioners. And it might be that you look at this list and say, oh, actually, well, I've got connections with all these people. Sometimes we often find they're quite informal or maybe disconnected. So this kind of formalizes that joint working with shared goals. So looking at what will the partnership work on, so what will it actually look like in a city? Now we've got a broad structure and some clear goals for the pilot, but the detail, the outcomes that they focus on, the interventions that they used, how it will be delivered, that will be shaped by the partnership. So each place, city, depending on kind of the geographical location, is different. And we want to reflect that local context. So not we're not forcing a one size fits all approach. City A might have different priorities to city B, and that will be built into this. It won't be the sense of you're given a list of actions to do. It'll be around the city coming together and deciding what outcomes you might want to achieve, what might you want to work on. So, however, at the same time, we know that a lot of challenges are shared, and so there will be some tried and tested ways of tackling them. So for us, it's kind of finding that sweet spot in the middle between local ownership and partner and flexibility, backed up by what we already know. Um, so for those who have, we've got a number of cities who have already kind of put their hands up and said they want to be part of the first cohort of this pilot. We're going to host a theory of change workshop with them in July to kind of help map out what that theory of change might be. What outcomes do they want to see at the end of this? So I mentioned what actually the pilot will focus on will be dictated by that city, by their local context. But there are some things that we know, and I'll go over these in the next couple of slides. So one of the key things that we've learned from kind of previous initiatives is that substance misuse doesn't look the same across all students. So there's different groups, each with kind of their own needs and challenges. So this pilot will be kind of designed to be flexible in how it supports the full spectrum of students. So you've got the students who don't drink or use drugs. You've got students who kind of use at lower levels who are probably not going to come into contact with your drug and alcohol services. They're probably not going to come into contact with other bodies in the city. But doesn't mean that there's no support, there's no initiative that could be targeted towards them. We've got students who use at higher risk levels. We've then got the dependent students who probably do need more specialist support from your local drug and alcohol provider. And then we've got students in recovery. So this pilot will consider that whole spectrum of cities. And I know there's lots of good work in kind of recovery cities happening at the moment, and that's not to take away from it. This will look at the whole spectrum of it. So this, as I say, is not just about those who kind of have a serious substance misuse issue. It's about meeting the student where they are on their journey, and ensuring that no students, kind of no matter their situation, we want them all to have the right access to support and information. So what might the partnership actually focus on? So this, as I say, this area of work we very varied, and each city will have the flexibility to prioritise what matters most to them locally. These are just some ideas. They are not to dictate to the city, but these are kind of starting points that cities might want to take in kind of what actions, what areas they want to work in. So we've kind of got the welcome period. We know that brings extra challenges with drugs and alcohol in the city. It's typically a time where students drink more alcohol. In terms of drugs, if a student is using drugs before they come to university, they're now in touch with different dealers, and with that comes risk. It can be a time that students experiment. So we know that there's kind of an increased challenges at this time. And what I see at the moment is when I do sort of support HE in this is that if you've got multiple universities in a city, those multiple universities might be doing different training. They might be doing different comms during that time. They might be doing different nighttime safety schemes. You might have the local drug and alcohol provider in that city who might have their own comms or events during that. You might have the police in that city who recognise that you're going to have a sudden influx of students, many kind of drinking alcohol, and they've got their own policies in what, well, do we need extra police? Do we need security? What we want to do is actually, well, that time should be kind of working together. Um, it might be educational materials and events so that we're not kind of duplicating efforts. We might be looking around the supply of drugs. Policies, so policies in FE and HE will often vary across a city. So some will have a policy on drugs and alcohol, some won't have any policy. What's in that policy will often be different. Um, Training. So if we think lots of organisations are training at possibly the same time during the year. Um, Alcohol poisoning and overdose, that might be something as a city that you want to look at. Support pathways, drug alerts, kind of early intervention to kind of stop students getting to that more serious drug and alcohol where they need support. Students in recovery, around how the city supports that, and around community relationships, so relationships between students and community residents. So there are areas that might want to be considered, but again, it is completely up to you. In one of the early conversations I had, one of the higher education said, well, we still really want to focus on spiking. That's still a thing in the city for us. So that might be something that they look at. It will be different per city, but there are some kind of areas that probably will work across all cities. So now that we've kind of covered what the partnerships might focus on, we're going to just turn to how they might actually work together. So I'm going to outline how partners in the city might connect with each other and then how cities might connect with each other. So there's almost two areas of work. If we think the area of work of working together in the city with all your partners, setting outcomes, evaluating, and then the working across cities, we've almost got like two areas there. So the first is around, this is a suggestion. So these are kind of a suggested way for cities to work together. But again, will depend on that local context. So firstly, there's likely going to be an initial launch meeting. So where all the partners come together, set out expectations, clarify roles, and kind of begin sort of local action planning. It's suggested that that's kind of followed up by quarterly steering group meetings to kind of review progress, address any challenges, and adjust the approach if needed. There will be kind of evaluation and aspect running through this, so guiding on what data to collect, and how that might be collected. And I'll talk about evaluation a little bit more. And then there's the student survey. So what we know in a city is often missing is data around student drug and alcohol use. So there's lots of ways in which we collect drug and alcohol use in a city, but it will tend to be for the sort of entire population. It might be for those who access A&E. It might be for those that come in contact with the police. It might be those that access drug and alcohol service, but we kind of miss the picture of what our students actually doing in this city. So we will be supporting that city kind of data gathering. So that's kind of how the city might work together, and as a suggested way. A suggested way for how the network might together. So this is City A, City B, City C, all coming together. We're suggesting that we would facilitate good practice sharing meetings where all the cities come together, key people from the cities. So this is not just about universities from across the city coming together. This is about police from across the city coming together, public health, councils, private accommodations. We propose that one of those cities will host a kind of annual get together where we'll showcase progress, have keynote sessions, peer exchange. And then we want to provide lots of opportunities for city teams to present at kind of national and regional conferences. And again, not just thinking about higher education conferences, which there will be numerous we can present at, but thinking around private accommodation conferences, police conferences, NHS conferences, because this will be a kind of city-wide approach. And just to say from that, because Nick has asked us as SOS to support the kind of implementation of this, each city will get a named contact from SOS UK, not to kind of dictate what you're doing, but to support and facilitate you throughout that. So now it brings to the kind of benefits. What this is a pilot, so it will be evaluated, but we're quite confident, or we're very confident, that there are going to be benefits from this work. We know, and I'm very sensitive to that, that everyone is really under pressure at the moment. So whether that's financial, staffing, time pressure, and this pilot isn't about adding more to people's plates. Definitely not doing that at the moment. It's about finding better ways of working with what's already there. So the benefits kind of come from coordinating existing efforts, improving communication, making sure that services and institutions aren't working in isolation. And we think there's a number of benefits, and I'll go through this, but we think it will support students more effectively, but we think it will well, we believe very strongly it's going to make the use of limited resources more effective. So some of those kind of key collaborate advantages that we foresee from the pilot um, is by joining things up, so we can kind of avoid duplication, reduce gaps, and make more of the resources. So some of the practical benefits is around lifting discussions with leadership across the city, so making sure that this is on people's agendas, improving communication between kind of partners. We know there's lots of communication anyway, but just kind of making that clearer and quicker. Better coordination to improve students' support and safety, and a more joined up response to incidences or concerns when they happen in the city. I would love to say that we would stop all incidences or concern, but that isn't going to happen. We will get a more joined up response. We get access to specialist knowledge that may not be available in-house. So your drug and alcohol services in the city are crucial to your higher education, but similarly, it's the same way back, because your drugs and alcohol services might not completely understand what's happening in the student body. So both of it is about sharing that expert insights. Sharing data when appropriate to give a fuller picture of kind of the local issues. So we all hold data on this, but it's about what data can we share to get a fuller picture of what's happening. For a lot of you, maybe sharing of resources will be really important. So this is about kind of pooling resources. So things like staff time, training, or outreach work. So in a couple of slides ago, I gave an example of welcome period, where that often being a time when lots of activities happening. What we've probably got happening is numerous different organisations across HE, FE, private accommodation, drugs and alcohol services, all producing information around that time, whether that's safety information. You'll have lots of actions taking place in terms of maybe extra people in the city. Rather than doing that all with one person in each institution or department doing that, wouldn't it be better to kind of bring it together so it's a more consistent pooling those resources? We'll have lots of training happening, actually, again, about pooling that. So we're very confident that actually this is about saving resources and saving time. It also means we get to extend it beyond the campus. So a lot of difficulties that higher education will talk to me about, the universities will say, we can only do so much because then that student's going to go in the city. And actually, we can't affect that when they go in the city. So as much as we do on campus, we can't do any more because they're going to go off in the city and they're going to drink, they're going to use drugs. So we've got the greater ability to kind of influence behaviours on and off campus. We've got that networking. So again, not only are you extending it from your campus to your city, we're going to extend it from city to city because you'll be able to talk to each other. And we really hope actually that the cities that take part in this pilot have the ability to kind of influence long-term strategies for student well-being. This is your opportunity to kind of really influence how big areas in student wellbeing are dealt with in future. Drugs and alcohol is just one of many things that go into student wellbeing, mental health, sexual violence. Um, there's lots of things around student wellbeing, and actually, we're hoping that this pilot will shape how we look at that in future. So it's your kind of opportunity to be part of that. I kept saying I'll talk about evaluation later. We've got to that point. Um, so evaluation is going to be a core part of this pilot. So it's not just about to show impact, which obviously we hope to do, but to understand kind of what works and why it works and how it can be improved. So from the very start, when designing this, when having the initial meetings with Nick and his team, we knew that kind of evaluation needed to be in that. And we feel like you'll remember from like the initial slides, that's often missing in terms of where cities are working really well together. Um, Now I've taken this picture out of the funding bid, so people be pleased to know that the evaluation should be fully externally funded. So we've been pleased to be working with the Drug and Alcohol Research Centre at Middlesex University, who will lead the national evaluation. They're going to be the blue person in the middle of this diagram. Um, so they've submitted a few weeks ago now a funding application to NIHR to fully evaluate this work. Um, this diagram was hoping to show in simple terms what that evaluation will look like. So if I try and go through this, so in the white, that is a local evaluation coordinator. So each city will be funded to have a local evaluation coordinator. The funding bid that has gone in is it would cover about 20% of the time of an early career evaluator in the city. So we've built that into the 20% of their time. They'll oversee the local data collection and they'll kind of help shape the project and they'll link it with the Middlesex University team. They'll also lead a small team of 4 to 6 student evaluators who will also be compensated for their time. That'll be within the funding. And they'll be trained and paid for their role in kind of collecting insights from their peers, the wider student body, talking to stakeholders in the city. So they are the white circles. And then in the middle, you'll have the team at Middlesex University. They'll act as kind of the national evaluation lead, bringing together learning from across the cities and supporting the local evaluation teams. So that's kind of what the evaluation will look like. And that bid has already gone in. Okay, before we move to kind of the last section, which is next steps and then questions, I just wanted to take a few minutes to cover some of the most common questions we've already been asked about the pilot. So the kind of thing that's coming up in meetings that we're having at the moment. So the first one around is how it's being funded. So it's a mixed model of funding, of where we will be looking to fund it from multiple partners across the city, and possibly even external funding to that city. We are asking for a contribution from universities of no more than 6,800 per year. I say no more because I fully understand the kind of financial situation across higher education at the moment. And if we are able to reduce that, we will, because we will look at bringing in external funding for that. So that is kind of the top that we would be asking for funding. And hopefully you'll see from the kind of benefits and the shared resources and the improvement, actually we anticipate that savings to come back in terms of those benefits and staff resources. We will be asking FE for a contribution of no more than £850 plus VAT, and then the remainder of the funding we're already talking to other partners in the city. Can we join if we have one HE provider in the city? The answer is yes. And we say city, it can also be like town, geographical footprint. So the five, and actually this comes on to the next one, is there still space to join? We are progressing at the moment with 5 cities already. So there are 5 cities where we've had interest from several HE and FE in that city to be part of the first cohort. So we are looking at progressing initially with 5 cities, but we are exploring a second cohort following that one. So if you are really interested in this from this, please do reach out, because there kind of will be a second tranche of this. And within the first pilot, we will be probably looking at multiple cities where there are multiple HE across the city, but we can do where there's one because this is also FE as well, so there will be colleges in the city. It refers to a city. What if we aren't a city? City kind of has just been the ease of saying because we start talking about place for a while. Towns, we're following kind of a public health geographical footprint, but yeah, towns, city, places. If you're not in a city, that doesn't exclude you. We are doing towns and geographical footprints as well. Okay, so the last before I kind of pass back over to Nick to give his concluding thoughts, and then going over to questions, is kind of next steps. So we've covered the why and the what. So I suppose we're going to finish with the how. So this section's kind of outlines what's going to happen next. With the cities that are ready to move forward. So those 5 cities we're already having conversations with, and how others can show interest after the meeting. So for the first group of cities, we're starting early planning kind of right away. So the next few months will look like between May and June or July, sorry, of briefing those city partners. We will then have theory of change workshop in kind of setting out what cities what they want to achieve, kind of their shared priorities. And then between August and September, we'll kind of support those cities to begin putting that local partnership structure in place. This is just the start. So as I said, if you're interested but you're not sure that you could commit to this initial time frame because we aren't having those conversations at the moment, as I say, we're hoping that this will then plan for a second wave. We're very confident that this approach is the right approach. So actually, it's not an isolated pilot. We hope it's an approach that will be rolled out. Okay, I am going to stop for questions. I can see there's chats and things. I can't see them while I'm presenting. So I'm going to stop presenting and just pass over to Nick for any kind of concluding thoughts, and then we'll open up for questions.
Thank you, Tracy. What a tour de force that was. And for those of you who haven't experienced Tracy's clarity of thought before, then I think that was a wonderful display of it. What I hope you'll have picked up is really 2 things. One, and perhaps really importantly, is the ethos with which we're trying to do this. So it is an ethos of partnership, of equity of regard, of working alongside each other, and of co-design. So you'll have noticed that Tracy, on several occasions, was talking about how we build on current practice, how we make sure that we weren't dictating a single way of doing things, but have got enough comparability through that co-design process and trying to give really good voice. So that ethos, I hope, is really clear, and I hope it's attractive, but at least it should be laid out, and I think Tracy's done that really effectively. The second part of it is really that there's a degree to which what we're not trying to reinvent wheels, and we know that there's great practice going on out there, and we really hope that what might be contributed through these projects is to coordinate and to amplify and to increase the impact and the broader impact of the interventions and work that's being done. And as we go along through the pilot, of course, there might be some areas where their practice is not quite as advanced as others, so we hope that there could be some collaborative effort on enhancing that practice as well. But what we really hope to do is think about coordination, collaboration as a mode of improving impact and gathering the evidence that helps all of us in this community to ever strengthen the argument for the approach that we're taking. So I hope that's not an unreasonable headline summary, Tracy, and thank you for a wonderful presentation.
Thank you, Nick. So we'll move over to questions now. I can see a few questions coming through, all the same actually so far. We've got three questions of the same. Who are the five cities? Um, so the initial we've gone out initially to HE and FE to see who would be interested. We're then now starting the conversations in those five cities with all the other key people that would need to be brought on board. The five cities where we've had HE and FE interest to take part at the moment is Manchester, Bristol, Cardiff, Brighton, and Newcastle. So within there, we've either had one or multiple HE say that they would like to take part and FE as well. So if you're in those cities and you're in HE or FE in this call, hopefully you know soon that you'll be taking part in this. If you are from other organisations, so I know we've got police, public health in this. We will be in touch very shortly after this webinar to start briefing and bringing people together. Um, I can just see a chat. How long will the pilot run? So the pilot will run for 2 years. I feel it'll take 2 years to fully kind of see the impact. The evaluation part of it, so the NIHR funded evaluation would start from February next year and run for 14 months. Um, we will find out. NIHR funding takes a long while to we'll find out in November whether we are successful in that funding. We are quite confident in that. And the Middlesex research team who have put that in are also very confident in that. Um, I'm just checking the question and answers, so bear with me. Are you speaking to national groups? So yes, at the moment I suppose the initial part has been starting formulating what these might look at, and we reached out to the kind of higher education and further education partners first. We are then mapping out all the other contacts in the city, which HE and FE will already be included in. And we will be starting very shortly to make meetings around that. Um, I'm just reading, sorry. In one of the slides, it indicated the organisations that would be involved across the city. Did it mention providers of substance use? Yeah, so absolutely. We've included them as third sector, sorry. So absolutely, they are crucial to this. And so we've already started, I've identified in the initial five cities who they will be, and hopefully some are in this call today. But yeah, absolutely, they are a crucial partner in this. Who are you asking for that? So the 6,800 plus VAT is the maximum we would be asking a higher education institution to put in. Um, it is a mixed funding, so we are looking at other funding in the city as well to help run this. But the 6,800 is for the maximum we would ask a higher education institute. Um, And the last one is Salford included in the Manchester cohort. Nick is the Vice Chancellor of Salford, so I don't know if Nick wants to answer that one.
Yes, is a short answer, and we're thinking Greater Manchester, with including Salford and the surrounding districts.
Okay, got more questions coming through. Is the pilot working with existing community safety partnerships? Yep. So what we will, this isn't looking about duplicating work. It's about bringing those networks together in a focus around, I suppose, student drug and alcohol use. Um, your key thing there is particularly to avoid any duplication. There is no point doing duplication. This is about kind of elevating the drug and alcohol and student use agenda and kind of bringing together what's already happening, setting outcomes of what we want to achieve, and that key point of evaluation, which I think is often missing. Um, and then we've got a question around the funding. Is that for the activity within the city or part of the cohort? It's funding towards both. So it's funding towards what's actually happening in the city and what that, and also being part of the national cohort of cities. Um, Another one around the funding, that is per HE, that the funding request. And was there any other questions? And please feel free, if you want to ask it in person, you can raise your hand and then we can unmute you, I believe, from the webinar function. Okay, I've just popped. We'll be asking the local authorities to contribute. So there'll be the discussions that we're now having post this kind of webinar. So yeah, I will be kind of reaching out to other partners in the city and we are exploring other funding. Um, so if you are in one of the cities that we have already kind of started those conversations with, and we haven't been in touch yet, we will be in touch. But if you want to drop me an email, that's always handy because I know then you know the right people to speak to around this. So please do drop me an email. If you are in a city that, if you're in a city, town area, however you want to call it, and you aren't in those kind of first five cities, but are interested in just starting the conversation, you don't have to have everyone having said yes, but you're interested in starting that, do drop me an email. Um, which I think I've just answered that question. For HEs that like to get involved in the second high court, how do you prefer to be contacted? Yeah, so please do reach out to me via email. Happy to go through kind of any questions that you have from this webinar, but also just start those conversations if that is something that you're looking at. Um, I do really believe this is going to be a really exciting piece of work to be involved in.
Tracy, sorry to interrupt. I just wondered if people have got your email. I
I've
know it's in
just
the slide.
popped it in the chat. Did
Oh,
everyone
it's in
get,
the chat, is it?
did
Right,
everyone
yeah.
get that? Yeah. I thought it was easier to copy and paste rather than put it on the screen. Yeah, so if do contact me, we will send out the slides and recording from this anyway. So you'll have mine or my colleague Fiona, who you've been seeing writing in the notes, our email address as well. Uh, what do you think students think of this approach? So something that I didn't go cover actually is we're going to have we're going to have kind of two advisory boards for this project. So we're going to have the main advisory board and we're going to have a student advisory board. So students are very key to feeding into this. This should be student led, it should be student developed. So we will have two advisory boards running, and one of them will be made up of students. So we'll be able to fully utilize kind of their direction in this. We do suggest as well, again, this is about city facilitating what your kind of need and context is that there is a student on that kind of steering group. Um, so yes, student led will be in this. Nick, did you want to say any more on that?
Yeah, just briefly, thank you, and thanks for the question, Paul. In the research that led to this stage, obviously there was a big survey that we referred to, but also we had student focus groups around the country. We had student panels, and there were student co-leaders of each of the expert panels that we had. So they've been absolutely centrally involved with the whole of the research and then the design process. So I'm pretty confident that at least they would recognize that.
Yeah. So, do you get much feedback from staff? I'm not sure I fully understand in terms of feedback prior to this or feedback within the pilot. Um, and I don't know if maybe you could type Paul in the chat. In terms of what I'll answer what I think maybe it might be. In terms of feedback from staff is has contributed to why this pilot has been developed. In that we often, as I said before, we get frustrations in terms of we can only do so much on a campus, and then students go off into the city, and we've got limited reach. We've got feedback from staff that they often work with community partners, and they do, and I really don't want to sort of negate that. Um, but it can be slightly inconsistent, or it can be kind of ad hoc. And they might have a relationship, but not necessarily a shared outcome or a shared goal. Um, so we've definitely had feedback from staff that's led into kind of the formation of this, and we will continue to have feedback from staff because this will be co-developed by those cities. They'll be developing the theory of change. The theory of change won't be developed by me or Nick. Um, so yeah, they will continue to feed back in. So both, yeah. So the reasons we've led this is based on feedback from staff, but also we'll get feedback from staff throughout this. And actually, the evaluation model I showed, one of the things within the funding bid is that those student evaluators will interview stakeholders from across the city. Um, okay, we're coming off to an end, and everyone looks to be jumping into other meetings or probably for lunch. Um, if Yeah, I'm going to end it. Oh, we've just got one more question come in. Um, what's their take on it? Have they been involved in developing I don't know who you mean by there.
Is that staff? I think it must be.
Oh, right, staff in developing the pilot. So yeah, they will be, well, they'll be set, the theory of change will take place in July. So at the moment, we're just having initial conversations to bring people on board, but they'll be invited to the theory of change in July. And also to say that the pilot format is not set in stone yet. If we start having these conversations and realizing that we need to change it, we will change it. It's not set in stone at the moment. We're kind of in the planning stages. So as we start talking to city councils, police, public health, private accommodation, we can mold it as we need.
And perhaps, Tracy, I could just add very, very briefly, Paul, it's a great question. And actually, there's a lot of expert staff and specialists were involved in the first project, and this design reflects their input. There are also staff who come across things that they're worried about, they want to help, but don't have the expertise, and therefore for them there was a different question of how they refer people on into the right situation. Both of those ways of thinking are fed into the design.
Thank you. Well, thank you for everyone for coming, and I will close it there. We will send out the recording and the slides, and hopefully I'll be in contact with lots of you on this call afterwards. And thank you for Nick for giving up your time.
Well, thank you, Tracy. Absolutely fabulous. And thank you, everybody. I look forward to meeting you and hopefully working together.
Yeah.
Thank you.
Thanks. Bye.